Good morning everyone. So in this video you are going to see some of the basic questions for upcoming norcet examinations and mhsrb Telangana staff nurse examinations. So the first question is, select the option of principles of primary health care. So the options are: option A, equitable distribution; option B, community participation; option C, coverage and accessibility; option D, appropriateness and continuity. So what may be the right answer? The right one is option D, appropriateness and continuity. So this is the principle of primary healthcare. But equitable distribution, community participation, and coverage and accessibility, these are the functions of community. Okay, so functions of primary healthcare, but the principle is appropriateness and continuity. The primary healthcare should be very appropriate, one by one, and clearness, and continuity is a continuous process. We should not give any gaps in the care of primary health care. So the next question is, entomology is the science that studies. So options are: it is about the behavior of the human being; it is study about the insects; behavior of the ants; formation of rocks. So what may be the meaning of entomology? The right one is option B. Entomology is nothing but it is study about the insects. So the insects physiology and anatomy and their everything will come under the study of entomology. That is option B is the right answer. The next one is, the following are functions of the male health worker as a health team member except one. Options are: option A, conduct a survey of subcenter, recording of all family details, provide nutrition advice and immunization to the mothers and children, maintain information all vital events, promote health education activities. So what may be the male health worker, not the function? So as a male health worker, you should know the one function, that is option B, provide nutritional advice and immunization mothers and children's. Why? Because this work can be done by the female health worker. Okay, so female health worker, they can go for the nutritional advice and immunization for the mothers and children's, but these three are the functions of male health worker. So the next one is, the characteristic of primary health care as compared to secondary and tertiary health care is. So when comparing with the primary health care is with the secondary and tertiary, options are: it is less costly, it is less costly, it is more costly, less efficient, lack of resources. The right one is, it is less costly. So that A is the right answer. Why? Because primary healthcare is less costly with the secondary and tertiary healthcare. The next one is, all among the following are the characteristics of secondary healthcare except one. Except is the not. So the options are: procedure for diagnosis and treatment, first referral center, degree of specialization, complex surgical procedures. So the right one is option D. Complex surgical procedures are not come under the secondary health care. Okay, so these are the come under the secondary health care, but complex are surgical procedures which are not come under the secondary health care. So the next one is, in prevention of communicable diseases, the primary prevention results from. So the options are immunization, early diagnosis, strict isolation, treatment of disease. The right one is immunization. So immunization is a primary prevention. So it is results prevention of the communicable diseases by the primary prevention. It is immunization. The next one is, pap smear screening is an example of. Options are primordial prevention, primary prevention, secondary prevention, tertiary prevention. So the right one is secondary prevention. Why? Because already the person have risk for the vaginal infection or vaginal cancer. So the doctor advised pap smear. So it is come under the secondary prevention. The next one is, monitoring of blood pressure is which level of prevention? So the options are primordial, primary, secondary, tertiary. So as usual, it is also secondary prevention. Monitoring is nothing but the patient is already having the blood pressure. So we are monitoring and we are continuing that. So it is come under the secondary prevention. The next one is target group in secondary prevention. So target group is nothing but the people in the community. So options are healthy individual, healthy appearing individual, patient with advanced stage of disease, patient recovered from chronic illness. So the right one is option B, healthy appearing individual. So in this, the people are having the disease, but from outside they are looking healthy. Okay. So these are the target group in secondary prevention. The next one is, chemoprophylaxis is which level of prevention? Options are primary prevention, secondary prevention, tertiary prevention, primordial prevention. The right one is primary prevention. So primary prevention chemoprophylaxis are, we are giving the we are giving the medicines to promote the health and prevent the illness. Before illness occurring, we are giving the some of the medications which are come under the primary prevention. So we will see some of the levels of prevention. So firstly, primordial prevention. So in this primordial prevention, the people are maybe having the disease or not, but we are giving the mass education and the individual education. Mass education is nothing but for the group of people. Individual is education is nothing but for the single individual. So in the primordial prevention, we are going to the community areas and we are giving the health education for the a group of peoples uh, regarding the so and so diseases, okay, before occurring. But in primary prevention, there is a health promotion and a specific protection. For example, chemoprophylaxis. Okay, so chemoprophylaxis are come under the health promotion and specific protection. So the next one is a secondary prevention. So in the secondary prevention, the disease is diagnosed. Okay, so that is early diagnosis and prompt treatment. So the disease is diagnosed, we are giving the treatment for that disease. That is secondary prevention. Finally, tertiary prevention is disability limitation and rehabilitation. So in this tertiary prevention, the disease is diagnosed and we are giving a treatment, but the treatment is not effective. Maybe it is not effective. So what they will do, they will do the disability limitation, for example surgery. Okay, so surgeries and operations are come under the disability. For example, that is amputation and rehabilitation. So in the future, it should not affect to the other systems, that is tertiary prevention, primordial, primary, secondary and tertiary. So the next one is the most effective stage of nursing process. So the most effective stage of nursing process. Options are assessment, diagnosis, planning and implementation. The right one is assessment. Why? Because this is the first stage of nursing process. So if you do the assessment perfectly, then only you can diagnose the condition, then only you can go for the a perfect planning, and you can give the perfect interventions for the patient. So this is the important and crucial stage. So whatever assessment we have to do, we have to do the assessment very perfectly from head to toe. Okay, that is physical examination and history collection and everything will come under this. So the most effective stage of nursing process is the assessment stage. The next one is chaustic sign seen in. So chaustic sign are seen in option A hyperglycemia, option B hyponatremia, option C hypocalcemia, option D hyperkalemia. The right one is option C, hypocalcemia. So hypocalcemia, that is nothing but decreasing of calcium in the blood. So in this condition, there is a positive of chaustic sign. So chaustic sign is seen in the face. Okay. So when we tap the ear side, the muscles which are present in the right side or left side, it will move. It will react. That is chaustic sign. So in the case of hypocalcemia. Next one is HIV cases are reported from world is known as. So from the all over the world, the HIV cases are reporting. So what it called? Options are endemic, pandemic, epidemic, sporadic. The right one is pandemic. So pandemic is nothing but when there is an infection in the worldwide. For example, corona. Okay, corona also come out of the pandemic. Why? Because all over the world it is present. The next one is the condom can be prevent. Options are sexually transmitted diseases, pregnancy, vaginal infections, all of the above. So the right one is option D, all of the above. So the condom can be prevent the sexually transmitted diseases as well as pregnancy, unwanted pregnancy and vaginal infections from the sexual intercourse. So the condom can be do the all functions. The next one is the patient entered into the post-operative ward. To prevent post-operative complications, as a nurse, make the patient to do. So, as a nurse, what she has to do, prevent the post-operative complications. Post-operative is nothing but after the surgery. So, the options are deep breathing exercises, coughing exercises, using of spirometer, all of the all of this. So the right one is option D. So to prevent the post-operative complications, we can go for the deep breathing and coughing exercises, and we can encourage the patient to use the spirometer. So by doing this, all the things, the patient can improve the breathing pattern and to control the complications. So mostly in the post-operative period, the patient is affected by the anesthesia effect. Okay, so due to the anesthesia effect, the person can have the some of the complications. So maybe the breathing difficulty. So to prevent the breathing difficulty, we have to advise the patient to do the deep breathing and coughing exercises, and encourage the patient to do the spirometer. The next one is the most common causes of developing postpartum hemorrhage. So the options are: option A, retained placenta; poor maternal effort; atonic uterus; all of the above. So the right one is option D, all of the above. So postpartum hemorrhage can be happen due to the retained placenta, some of the fragments which are present still in the uterus, and poor maternal effort, and atonic uterus. So atonic uterus is nothing but the uterus is not coming back to the normal position. Okay, so tonicity is nothing but tonic is the contractions, but atonic is the absence of contraction. So the right one is the all of the above. The next one is the drugs relieves. Okay, relieves flatulence is known as flatulence is nothing but gas gas in the intestine. So which are the drugs are remove the gas from the intestine? Options are carminatives, purgatives, antacids, astringents. The right one is carminatives. So carminative are the drugs which relieve the flatulence. The next one is the contraceptive efficacy can be measured based on. Options are life table index, people's knowledge, family planning, Pearl index, and life table index. So the right one is option D. Option D is the Pearl index and the life table index. So this is the right answer. So it means occurring of pregnancy during the usage of contraceptive method. So there is a couple, they are using the condom. Okay, for example, contraceptive efficacy, that is example of condom. So the couple are using the condom. So during the usage of the condom, the couple have got the pregnancy. Okay, so they have got the pregnancy. So by this they can estimate the efficacy of the contraceptive devices. So not only the condom, so it may be the intrauterine devices, IUD, and some of the pills. Okay, so which method they have used the contraceptive method. Okay, contraceptive devices, pills, or any burial methods and everything, if they got the pregnancy, so it is called as a contraceptive efficacy. So how much is effective for the people, that is contraceptive efficacy. So the next one is the size of yellow color IV cannula. Options are 18, 22, 24, 20. So the right one is option C, 24. So here you can see the yellow color is the 24 size, blue color is the 22, pink is the 20, green is the 18, 16 is the gray, orange is the 14. So this yellow color IV cannula mostly used for the children, and 18 case cannula mostly for the fast fluid infusion and blood transfusion. Okay. So the next one is umbilical cord composed of an embryonic form of connective tissue intermingled with the gelatinous substance is called. Options are option A Watson jelly, option B amnion, option C chorion, option D velamanthus insertion. The right one is a option A Watson jelly. So the Watson jelly is present on the umbilical cord. The next one is a phantom or false pregnancy is known as option A stria gravidarium, option B pseudocyesis, option C gravida, option D nullipara. The right one is option B is the pseudocyesis is nothing but false pregnancy. So in this the women have the some of the symptoms of presence of pregnancy, but the real thing is the the woman doesn't have any baby in the womb. That is false pregnancy. The next one is the cellular shrinkage causes due to the which solution? Okay, cellular shrinkage is nothing but the cell is looking like this. Okay, but shrinkage is nothing but it is going inside. Okay, it is becoming small. That is shrinkage. So like this. So which solution can have the occurring of cellular shrinkage? Options are hypertonic solution, hypotonic solution, isotonic solution, all of the above. So the right one is option A, hypertonic solution. So when we give the hypertonic solution for the patient with the edema, okay. So in the case of edema, we can advise the, we can go for the administration of the hypertonic solutions. The last one is a patient is assigned to a nurse who is having fluid volume excess and having respiratory distress. So what would be the nursing intervention? Options are elevate the head end, promote fluids to improve urine output, deep breathing and coughing exercises, do the postal drainage. So what is the right answer? That is elevate the head end. So why? Because due to the over fluid in the body, so when there is a increasing of the fluid effect on the brain, so it leads to the respiratory distress. So we need to keep the position, that is head end elevation. Head end elevation, by doing this the pressure it will reduce on the brain. We can improve the respiratory pattern of the patient. So this is the option A is the right answer. So thank you guys for watching my video. Please subscribe and share with your friends.